Medically diagnosing a stroke, there are several tests that may be done. Initial studies are going to be looking to determine what type of stroke it is and to see if the patient would benefit from TPA therapy. A lumbar puncture, also known as a spinal tap, is performed when there's a strong suspicion for a hemorrhagic stroke in someone whose CT scan does not show clear blood. When there's bleeding in the brain, blood can also be seen in the cerebrospinal fluid. Magnetic resonance imaging, or MRI, this is one of the most helpful tests in the diagnosis of a stroke because it can detect strokes within minutes of their onset. Its images of the brain are also superior in quality when you compare them with the images of a CAT scan image or a CT image. It is because of this the MRI is the test of preference in the diagnosis of a stroke. A special type of MRI is called a magnetic resonance angiography, or an MRA, and it lets the physicians precisely visualize the narrowing or the blockage of blood vessels in the brain. A transcranial Doppler, or a TCD, this test uses sound waves to measure blood flow through the major blood vessels in the brain. Narrow areas inside of a blood vessel demonstrate a faster blood flow than normal areas. This information can then be used by the physician to follow the progression of occluded blood vessels. Another important use for the TCD is in the assessment of blood flow through blood vessels in the area of a hemorrhagic stroke, as these blood vessels have a propensity to undergo vasospasms, or a higher risk to undergo vasospasms, which is a dangerous condition of the wall of a blood vessel, which then blocks blood flow again. Cerebral angiography is a test that will visualize blood vessels in the neck and brain. It is a special test using a special type of dye, which can be seen on x-rays. The dye is injected into the carotid arteries, which bring the blood back to the brain. And in a person who has a partial or a total obstruction in one of these blood vessels, or in any other blood vessels inside the brain, there will be little or no dye seen flowing through it. A common cause of stroke is the narrowing of the carotid artery, carotid stenosis, which is usually the result of cholesterol deposits along the wall of the blood vessels. The condition can also be diagnosed by a test called a carotid duplex, which again uses sound waves to evaluate blood flow through the blood vessels. Electrocardiogram, sometimes referred to as an EKG or an ECG, helps to identify problems within the electrical conduction of the heart. Normally, the heart beats in a regular, rhythmic pattern, which promotes smooth blood flow toward the brain and the other organs. But when the heart has a deficit in the electrical conduction and it stops beating rhythmically, you see your patient experiencing arrhythmias. Some arrhythmias, such as the atrial fibrillation, causes the formation of blood clots inside the heart chambers. And it is these blood clots that will sometimes migrate to the brain and be the cause of a stroke. Depending on the degree of narrowing and on the symptoms felt by the person, surgery may be needed to remove plaques from the affected arteries. Transthoracic echocardiogram, or a TTE, also known as an echo, it uses sound waves again to look for blood clots or other sources of emboli inside the heart. It is also used to look for abnormalities in heart function that leads to blood clot formation inside the heart chambers. TTEs are also used to investigate if blood clots from the legs might travel through the heart and reach the brain. And last but not least are the blood studies. However, blood studies, for the most part, are done to look for diseases known to increase the risk of stroke, such as high cholesterol, diabetes, blood clotting disorders. Early recognition. The Cincinnati Pre-Hospital Stroke Scale, these three bullets on the slide are the things that you're going to conduct with your patient. The patient is asked to show their teeth or smile. A normal finding is that both sides of the face will move equally and well. An abnormal finding is that one side of the face does not move as well as the other side, or it doesn't move the same. Then the patient is asked to close both eyes, hold both arms out straight for 10 seconds. Normal finding is that both arms are going to do the same thing, or that both arms are not going to move and will stay straight. An abnormal finding is that one arm does not move while the other arm begins to drift downward. The patient is asked to repeat a simple phrase such as, "You can't teach an old dog new tricks." A normal finding is that the patient uses the correct words, repeats it without slurring or difficulty. An abnormal finding is that the patient slurs the words, may use the wrong words, or is unable to speak at all. In the acute phase, this is going to begin with the onset of signs and symptoms and continues until the vital signs, particularly the blood pressure and the neurological conditions, begin to stabilize. This acute phase usually lasts between 24 and 48 hours. Many medical management interventions are directed at minimizing the complications and the deterioration of the patient's condition after a stroke. Care is going to be focused on stopping or decreasing the ischemia of the brain tissue, treating hypertension, oxygenation, hyperthermia, hyperglycemia, whatever the case may be. Medications such as mannitol, Nimotop, Dilantin, phenobarbital, aspirin, Ticlid, Agranox, Plavix, and Retivase may be ordered. Aspirin is recommended within 24 to 48 hours at an initial dose of 325 milligrams. But aspirin cannot be given to this client if they have had TPA within the last 24 hours. Medical treatment can include urinary elimination, indwelling catheters to manage urinary incontinence, or intermittent catheterization to control incontinence caused by flaccid bladder. Surgical interventions may be an option for some patients with a hemorrhagic stroke. The decisions about surgery are going to be largely based on the patient's age, what their intracranial pressure is, and the location of the hemorrhage. Evaluation in the hospital and interventions are going to fall into the nursing care responsibilities. In addition to frequently monitoring the vital signs, you must also carefully observe for any symptoms of intracerebral hemorrhage or any other signs of bleeding during the administration of TPA. Observe the level of consciousness, any cognitive changes, communication changes, symmetry, motor, sensory, or visual changes in the client. Get a detailed patient history, frequent vital signs. Get the CAT scan ordered and completed. Establish an IV. Get them on a cardiac monitor. And if they are patients that do qualify for TPA, get it administered. Activase. Activase is the only drug approved for the treatment of acute ischemic stroke. Chart 45-5 in your 8th edition, 47-5 in your 7th edition.